Sorry about that.
That's okay. I think that was on me. Welcome to Wise Women Wednesdays. I'm Stevie Carr, founder and CEO of Wise. We are here on this super gloomy, snowy, yet beautiful Wednesday afternoon with Dr. Sarah Crawford, which is of Anchor, Cincy. So Anchor Wellness is an incredible, it's located in Kenwood area. But the concept is something that is just really new and refreshing to our region. We've seen this concept of really executing your wellness through a whole self lens, something that's very near and dear to Wise Wellness Guild. But what Dr. Crawford really brings to the table is really bringing in more than just about physical wellness. She really is paying attention to mental wellness, paying attention to how all of the different aspects of mind, body, heart, and spirit really kind of interconnect with one another. And so I really had the great pleasure to have gotten to know Sarah throughout the course of the past few months. And one thing that I can say about her is that as a strong, fierce, independent woman, we really kind of bond over the fact that we're looking for a community that we can really take a step forward with and step out of the dark ages of how medicine is administered. And so that's the piece that I'm just really proud to know. Sarah, Dr. Crawford, I believe will be one of the people that you will come to know and love within this Wise community as we continue to do more of these things. And I'm just really grateful for your time today. So welcome. Thank you so much for joining us today.
Well, thank you for having me. I am so humbled. Thank you.
Well, I appreciate it. And so just a little bit about for the community that we've got here. Rules of the road, as we always say. Dr. Crawford is going to take us through, what she wants to speak on her topic. If you'll stay on mute, just to eliminate any background noise, I would appreciate it. But if you have a burning question, put it into the chat or come off of mute. And what we'll do is we'll go ahead and just make this a dialogue and conversation. This is not intended to be a presentation or anything formal. It's intended for us to get to know a little bit more about the women-owned businesses in our communities. But hopefully you'll take away learning a few things about yourself, asking yourself the right questions, and then we'll open it up for conversation and dialogue. Around 12:45, we'll move into sharing wins and things that have really been rocking and rolling for you here in the last couple of months. We're getting towards the end of the year, and I want to give people the time and space to celebrate themselves and celebrate each other. And then we'll talk about kind of what's coming up for Wise. So first, we'll dive in. So Sarah, why don't you just share a little bit about Anchor Wellness and a little bit how it got started and what are some of the different things that you provide?
Sure. Yeah. So Anchor Wellness is an integrated healthcare collaborative where we bring like-minded health and wellness providers into the same space to provide this highly efficient, highly specialized care for users of health and wellness services. I think that individuals don't often think of themselves as consumers of healthcare. Healthcare has historically been a dictated delivery of service, has had this dictated delivery of service. And so Anchor was started to empower individuals to recognize their role in their health. And so we're trying to bring providers across the spectrum of care from medicine all the way down to movement, who believe in the philosophy that the client is at the center of this and that they get to drive care. And it came about from my own personal experience. I've been a physical therapist for 10 years and have built a practice around working with individuals with chronic pain. And I think what a lot of people don't know is that chronic pain is pain that's present for 3 months or more. And so when pain turns chronic, it's a different can of worms than acute pain, and it requires this multifaceted approach most often. Humans are the most complex species in the world, and to assume that any one provider or any one person is going to be able to answer all of your questions is ludicrous, right? And so I think Anchor serves this place, and where the idea came from is like, I got to get more people on my bench. I need to have more people ready to help these people that I'm not the full, that I don't have all the answers for. And so the idea was to really create these little mini systems, but cut out a lot of the bureaucratic red tape, cut out the need for referrals, cut out the need for insurance approval. And let's just give people what they need faster to help them get back to what they want to be doing faster. And quite honestly, a lot of the times more cost efficiently.
Well, and what I just love about your philosophy is that we're taking there's the Western approach, which is like, it's you're hurt, fix it. And then you're hurt, fix it. And you just kind of, but I think that being more integrative in the approach of just because your foot is hurting doesn't mean that the foot is the problem.
Exactly.
It could be stress induced, or maybe it's your back, or is it muscular? Does it have to do with your bone? Like, there's a lot of different, and it's about the actual questioning portion that I think is the really crucial piece. Is like, it is really about solving the issues where they're starting from, but really looking at us as whole living human beings and not just as a problem to fix. And so what are some of the things that you have found that you're seeing a lot of your clients come to you for as of recent? I mean, we're living and working differently right now, so I'm sure that you're seeing kind of an influx of a few things.
Yeah. So I think we're seeing a lot of sort of generalized pain. And I say that because I'm not just seeing it. We're not just seeing it on the physical therapy front. We're seeing it in the coaching front. We're seeing it in the dietetics front. We're seeing it through our Pilates and yoga services. And, I think what we try and do is make a therapeutic, take advantage of any therapeutic opportunity we get. And we're doing that in a Pilates class, right? So we're trying to educate people on like, what is physiologically happening in your body and why. So right now we're seeing these like what should be sort of mild aches and pains that are just so much more escalated because of stress. And there's not a human on this planet that's not currently experiencing stress. And if they aren't, they're lying, So, but when we're all under this level of stress, it takes our baseline, where we function normally, where our hormones, that, the level that it takes to bring us down for hormone reproduction, which I always tell people this, hormones in our body are basically what make the world go round. They're needed for every tissue. They're needed for every system. And, when we're in this heightened level of stress and our fight or flight, that desire to run from a tiger stays elevated, then we don't get back to that baseline that we need to for that hormone synthesis. And so what would be like a mild strain of a muscle, or what would have been like a headache because you carried something heavy over the weekend, but you rested and you got good sleep at night, now is turning into these lingering problems because we don't get rest. And the rest that we do get isn't restful.
Yes.
And so none of us are getting this opportunity to just breathe, because the moment you get to sit down, you're thinking about the very next thing. And that is uncharacteristic of any other year. We all are used to having circumstantial moments in periods of time, stressful fits, but we're not used to having stressful 10 months, 11 months with no break.
Well,
So yeah, I think a lot of things are just being amplified by the fact that we aren't getting rest.
and I think that, without sounding too salesy, because that's not what this is intended to be, but your space in particular is one that I know as a design snob, self-proclaimed design snob, when it comes to physical spaces, is so refreshing. And I shared this with you because I said, and this is not a knock on other physicians, don't get mad if you're listening to this, but it's very rare to have somebody who has a really great sense of aesthetic, but also understands. So when you walk into the Anchor Wellness space, it's first up in this beautiful, fresh new building. You walk in, it is just open and alive. And there's so many things that make you feel like home, but better, because there's not bowls of eaten oatmeal or coffee, just to name a few that I can like within my eyesight. I think that environment for me has been something that I have really been paying attention to during this pandemic, of not being able to get out of the environment that you're ruminating in, or that you're kind of like living, working, like grieving, sleeping, eating, like all the things in one space. And so I want to talk a little bit about your space itself that you have, because when I came in for my tour, the thing that I just noticed is like there's a lot of space to move. It's very open, very clean, very safe. But like in particular, the Pilates studio was something that I was like, this is beautiful and so great. How did you kind of have this multifaceted concept in mind when you designed the space? And then talk to us about some like key things that are kind of happening on a day-to-day basis. Because I think that would like really struck me as something new and different that you don't see with like a traditional wellness center or gym.
Yeah. So the design of the space came from the symbolism of the business being called Anchor. So Anchor is the international symbol of hope. And so the space is designed to provide just that for anybody who comes in. And that's pretty universal. And the idea is that it's fluid, right? You know, an anchor is fluid, and none of our bodies follow these rigid silo-based paradigms that we're often shunted into when we're seeking wellness. And so the space affords people to come and choose what they want, and in a way that is non-confrontational. You know, the providers we function independently, but we collaborate on every client that we share. And so the idea was, you know, to create a space that allowed somebody to feel comfortable enough to explore their own depths. And with the Pilates studio in particular, I didn't want it to feel like a studio. You know, I wanted it to feel more like a place where you could relax and find strength. And so it's intimate, and we intentionally have created a small studio so that we can still provide a therapeutic effect. A lot of times in Pilates and in yoga, you're sort of one of a number of people, and it's hard for an instructor to keep their eye on you. And, you know, and everybody that comes into our space, you know, the rule is that, you know, somebody's going to leave here knowing more about their body. And when you're one of 8 or 9 people, you don't get that same attention in a given class. And so that is, plus I hired a really great designer. I'd lie if I say I was doing it all myself, but yeah, you know, in working with her, it was, you know, the hope is the underlying message in our practice.
Yeah, I just really appreciate that you get to learn on an intimate scale. I know that for me, the first time I've ever done Pilates Reformer, and I told you this, I mean, it was like a really big class, and I was like, you want me to do this for the first time in front of all of these people? And as a person that suffers from back pain, and I've torn my disc between my L4 and L5 before, which you know, Sarah, but for the benefit of everybody else, I've been through multiple rounds of physical therapy, none of which have been with Anchor, because I've been fortunate enough, knock on wood, to have it under control somewhat. And when you think about the importance of that one-on-one attention in a space, a lot of times you get that in specific physical therapy, and then they set you free. And then you have to get referred back every time. And I don't want to knock, because there's a certain place for certain people and different ways of doing things. So like, I'm not saying that like the system is necessarily wrong the way that it is for some people. Some people have something that they're getting over and they're done. I'm saying that what I appreciate about the integrative approach is that for people like myself who want to get to the root of the problem and like maybe have had multiple injuries over time or want to do things the right way, I love that individualized attention. I want to understand a little bit more about when you talk about health coaching. So we know we're coming up on a new year. We're starting the Healthy Bodies challenge, which is it's the anti kind of diet, anti like these crazy lofty goals that like are unachievable. We're really trying to take a new approach to New Year's resolutions, and people might be interested in learning more about what an integrated health coach looks like.
Yeah. Health coaching is really neat right now. That's a sort of blanket way to say it, but a health coach is an advocate, right? So there's somebody who understands a lot, but isn't limited by a license, which is great. I've got a lot of training in nutrition, but I can't give any nutritional advice.
Yeah.
And a dietitian knows a lot about movement, but they can't prescribe movement. And physicians know a little bit about a lot of things, and so what's really cool about health coaches is, in my experience, a lot of the times they're coming into it with really personal motivations. They've been through something and it's sparked their interest in health. And so I think of health coaches as these advocates who are really able to engage an individual user and ask questions that sometimes are uncomfortable, but they don't have that white coat. They don't possess that white coat syndrome because they're you. They're another you who's interested and who has a lot of training, and can help kind of formulate what you're already thinking. So, you're somebody who's struggled with losing those last 5 pounds. You do all the nutrition pieces, you're exercising, but you're not managing stress, and you know it, but you can't quite put your finger on it. And so it's very client led. It's like the Montessori version of healthcare.
Yeah.
Like
oh, I love that.
It's client led, and they're working with you around what you want to do, and they just direct, right? And their accountability measures. So I think what's really cool about our health coaches in particular is that they have these specialty niches, one around nutrition, one around more of the somatic experience in dealing with, we all know that we have stress and we all cognitively know how to handle it, but what do we do about what we feel, like about the sensation that it creates in our body, and how do we just get comfortable with it? And so that's where our coaching is a little dynamic, I guess you could use to say that it's not as blanket as just like, reporting your food journal and telling somebody how much you've exercised. That's never going to work. Mm-hmm. So we're looking at we're peeling away the layers of the onion to get at, like, what you want to do, what you should do, but why aren't you doing those things? Mm-hmm. And it's deep. I mean, it's a lot of work, but they're lovely because they have such a breadth of training, but they're relatable.
Yeah. And I love that getting to that again, the why, right? I talk all the time, Laura knows about values, and I talk all of the time about what your motivators are, but it is very rare that when it comes to things like goal setting, the same way that we don't outline what potential barriers might be for ourselves, right? Like why you say you want to let's use the last 5 pounds. You've done all of this work, but you can't seem to do that. Why is it? Well, it might actually be attributed to the fact that like you aren't sleeping, and like it might just be that like your body like unable to allow for you to manage, like it might be in survival mode, right? You might be eating too few calories, actually. That's a phenomena that I learned about recently with a friend. It was like, how is that possible? Like again, I never claim to be the expert. That's why I leave it to you guys. But I think that there's for me, what I love about it just in general when we talk about coaches, because people are always like, oh, I can do it on my own. But when Laura has shared with us the philosophy of coaching in general is, do you want somebody with the proven track record that can help you kind of get to that, like get you on the right path, right? Like it can be self-led, self-motivated, but being able to be that person and that support along the way with all the tools in their toolbox that you are not equipped with. Like, and I mean, if you're the person, there's a problem that if you become an expert in losing the last 5 pounds, I really question on whether you're an expert at all. I want to let me know if you guys have any additional questions. I will keep rolling through. I have so many things to talk about with Sarah. So like, feel free to jump into the chat if you've got additional questions.
Just to comment on that, it goes back to the efficiency model of Anchor. It's like, yeah, you could figure it all out yourself, no question. And any of you can figure out how to do my job too. It's the efficiency piece. It's let somebody else guide you and save you time so you can focus on the things that bring you more joy. And instead of siphoning through Google.
Yeah.
And I think that truly, I think to me, is the health coach. I think the other key piece to know about health coaches is that they are excellent teammates for those of us who are licensed and carrying out some of our plans of care. So when I'm, treating an individual and we're like, look, there's something keeping this fire burning. And I know it's your relationship with work. Like you don't stop working. You're on your phone until 3 a.m. You get up at 7, you're burning the candles at both ends of the stick. We got to work on some of this, but it's not useful of my time to be working on that. Sometimes it is, but so a lot of times they're really great at helping the rest of our team carry out the things that we're picking up on. And that's where that collaborative nature comes in.
Yeah.
No,
Hey, Stevie,
yes, ma'am.
can I ask Dr. Sarah a question? Yeah. Hi, Sarah.
Hi.
Do you, would you describe this sort of like integrative functional medicine then?
Yeah, sort of.
Sort of?
Yeah, I mean, it's a buzzword that sometimes comes with a negative connotation, the integrative part. And yes, absolutely. I do think that we are providing functional medicine. 100%.
Okay.
I'm
just curious. I'm sorry. I'm curious about some of the services you provide. Like, do you provide like acupuncture or something like that, or medical massages or?
Yeah, so as we're building our team, we are definitely looking to expand. As we're building our in-network team, we are looking to expand to have massage therapy. We already offer something called trigger point dry needling, which is similar and very different from acupuncture, similar in that we use the same tool, different in different theory and physiologic response. We have health coaching, dietetics, and then some of the movement from Pilates and yoga therapy. That's who we currently have in network. We have out of network providers that we use right now that we think super highly of, but that just aren't in our center, from medicine to behavioral health to personal training.
Okay.
Yeah.
So one thing I know about myself as I've gotten older, I need to stretch more. And, you think you could Google it and you can look up all these different things, but is that something like I could call you and make an appointment to come in and say, hey, I had a knee replaced, sometimes my left hip. I mean, I just know that I've heard the people who say they stretch a lot just feel so much better, but it's almost like, I don't know where to start.
Absolutely. Yeah. And that's one of those things where, you could start with our physical therapist, or you could start with our health coach, or, you really could get a lot of the information of where to start with almost anyone on our team.
Okay.
But one of the things that we do offer is just a free 10-minute consult about where should I start? Because sometimes people know and sometimes they don't. Like a lot of times I encourage people to follow your instinct, right? Like if you think you should start with the dietitian, then start there because that's, you know, you better than I know you. And so, yeah, yes, stretching, you should definitely probably consult with a PT if you've had any replacement and all that jazz. But yes, that's the point of it all, is that we can help answer those questions and save you some time.
Okay, great. Thank you.
Sure.
One really kind of cool thing that there's a couple of different angles to go with this, but I want to talk a little bit about self-awareness, because I think that that's a core tenet of Wise Wellness Guild. And there's a lot that I know of content that you've produced, and you've talked about this a lot about that your services providing that self-awareness of maybe the core root of the issue, or just paying attention to, like when we talk about chronic pain, sometimes people aren't even aware that they aren't aware that they're in pain. They aren't aware that something needs to be stretched, or they're not aware of like that that their body could even do that, right? So I just want to talk a minute about self-awareness with our bodies, and like how your organization is really leading the charge in this conversation.
Sure. Yeah. It's funny. I recently saw somebody who just got off the campaign trail. And this person was like, I had no idea how much my body hurt. But when we are like on a mission, you know, it's funny. Our bodies, the human body is the laziest machine there is, right? So the human body will expend the least amount of energy to perform the greatest amount of good. And so, you know, our energy goes to whatever is at the forefront. And oftentimes, if it's something that's going to slow you down, you're just not going to listen. And so we talk a lot about that. A lot of time people leave our office with the only instruction of just pay attention. Keep a little note, right? Like take a mental note, because sometimes you've got these two ends of the spectrum of people who are a little too self-aware, and then the other end that's like not self-aware enough. So depending on who you're talking to, you're sort of coaching them in one direction or the other. But there is so much to be said for just paying attention. Yes. I mean, sometimes it probably would cost me money to say that, but a lot of times just by paying attention, you often don't need a lot of the services that you go to a health or wellness provider for.
I think that so that could be said for a lot of things, right? Like with and I know that your dream, you and I have talked about this, is like your dream is to actually work yourself out of a job, right? Because at the end of the day, like if you're doing this right, like people will be able to have the tools. I think that we're in a world that in our lifetime that's not real, so you probably have a lot of job security. But I do think that just even with like mental health, we talk about this, right? Like the pieces, you give people the tools and the mechanisms in order to be able to sustain themselves. But I do think that, like, I can say, Morgan, thank you for sharing that, you know, you didn't know that you needed someone to tell you how to sit comfortably. I mean, I really do think that when we're slaving over our computers and we're not, you know, the incorrect posture, or we're standing for hours. I have a standing desk, and like I just got a mat, and gosh, I know I'm getting old because my knees like have been hurting. But it's again like not even being aware of that and rushing through our day. It's not until we wake up in the morning and we can barely move that are we acknowledging that there's an issue. And I think that what Dr. Sarah is just really become proficient in is being able to not only she's giving you the tools to be able to do it on a daily basis. It's not like you need to go there every single day, which I think is really kind of cool.
We always tell people, you know, aches and pains are normal. It's a very normal part of life. An ache or a pain that's there for 24, 48 hours, but goes away is normal. Yeah. Something that lingers, and use ache or pain as a euphemism for anything, right? So that, you know, that anxious feeling that you've got, that pit in your stomach, or, you know, the headache, or that like block, that barrier that you feel like you just can't get through. Those things that, you know, those things that linger for a couple days, that's probably normal, circumstantial, right? But when it stays around for 3, 7, 14, 90 days, those are the things that you want to address. And that's where you start to wave. I always say, we talk about this in PT, but these white flags, they're sort of like the heads up before the red flag. My husband's always like, there's no such thing as a white flag. I'm like, yes, there is.
Yes, there are. And they're everywhere. And then the red flag happens right before the brick wall.
Exactly. Yeah. So, paying attention to those white flags, that's like your body, like just giving you a heads up. It's like when you are struggling to sleep 3, 4, 5 nights in a row. Okay, what's going on? What am I thinking about? What's keeping me awake? Or what am I eating right before I go to bed?
Mm-hmm.
Or am I exercising too late? Am I drinking something? Is it the glass of wine that's waking me up? It's just this introspection. And sometimes you're capable of figuring it out. And sometimes you need somebody to help you point it out, which is what we're there for. But a lot of times, I think, is we sort of just skip lifestyle and life, and we just straight go to like pathology in medicine, like it's like I come in and I tell you I can't sleep, and next thing you know, they're doing a sleep study and they're prescribing you Ambien and, the whole 9 yards, and nevertheless, you were drinking a soda every night before bed. So these are my frustrations. This is where Anchor came from, but I could go on with you about a million patients with similar stories.
Like that's the part again, like the one that I'm the most fascinated with that I know you and I have talked about is the how nutrition can impact so much of like your mood, right? And your mental space. Everything, right? Oh, yeah. Your joints, and I love the call out because you're so right. Even me, right? Like, don't tell me anything that inconveniences me with my lifestyle because like I naturally want to be lazy. I want to drink all the wine. I want to eat all the sugar and I don't want to worry about it. So like, just give me the tools of let me eat all the tacos and like also like have the like healthy body that will sustain me until I'm 106 years old. And like the reality of it is, okay, that we are in control of our own selves and we a lot of times outsource our bodies and our health to professionals, like Sarah was saying. And I guess but the one in particular, like I said, mood swings and mental health with nutrition is one that just blows my mind because I think that we think of them as two totally different things. And this is one where when we talk about healthy bodies as a whole, like that's the part I just am fascinated with the connection between the two because I'm so uneducated about it in particular.
Yeah. Let me give you all an example of just that like mind-body connection that I think is just such a phenomenal case. So I saw a woman last week who's been in pain for 22 years, a very traumatic injury as a child, and was at the time in the middle of a custody battle over her. So it wasn't shared amongst the parents the extent of the injury, and has gone sort of underground for 20 something years, a variety of other absurd, the trauma that one person has experienced in this period of time. She's been down this slope of medicine, of injections and medications and surgical interventions. And we had a 1-hour conversation. I never laid my hands on her. All we did was talk. And at the end of it, I said to her, you will get better. You do not need this surgery. And, but here's what you do need. We need to get you a behavioral health therapist. And we need to retrain some things around your body. I've not seen her in 10 days. Since that appointment, she's had like a 50% reduction in pain and she's slept through the night.
Wow.
Because I gave her space, right? I haven't seen her. I haven't touched her. I followed up with her to follow up on something else. And she's like, Sarah, since our appointment, I haven't slept like this in 20 years. And it was just, it's the weight of her life that is weighing down on her spine, and you're never going to see that in an image.
No. Ever.
You're never going to see that in an MRI or in an EMG. And that's the stuff that like just sort of gets to
No.
me about traditional healthcare
No.
because she deserved to be heard and
Yeah.
nobody had asked her the questions.
Yeah.
And she deserves to know that she's capable of feeling better.
Mm-hmm.
But she hasn't been told that. And so there is so much truth to what we think and how we feel. And so she's been going down this slippery slope with medicine thinking, well, this isn't going to work and this isn't going to work. And I know I'm going to need this med and I know I'm going to need this surgery. And it's a self-fulfilling prophecy. And so by just empowering her to feel better, even if it's for a moment, even if she comes back next week and says, well, I'm sleeping like crap. She got a week of sleeping better with less pain, I'll take it. And having done nothing but given her space. So there's so much truth to the power of the brain to help us feel better. And that's not to say that pain is in the brain, but it does dictate everything physiologically that happens in our periphery. So there's just, you can't treat the body and not treat the mind.
Yeah. I think that's, I think for me, like the interconnectedness between all of them is something I'm just incredibly fascinated with. And as we talk about, going into this next year, like, wow, 2020, who saw that coming? Nobody. But, here we are, and we're learning ways to manage and cope with things, right? We've got space, and it's about creating space, right, for this self-awareness, self-reflection. And I think that also acknowledging that maybe some things that we're trying to self-medicate or self-manage, that if you just had somebody to help you identify or pinpoint what it was, like, wow, how much that might set you free. Like, you don't have to live like this. And I just, like I said, there's pieces of this with like thinking about the information that you're intaking. I love that quote that like diet is not just the food that you put in your body. It's about like the 5 people that are closest to you. It's about having this like, what's the type of content you're taking in on social media. Like that is where I think the role of a health coach, of being able to work directly with somebody on like your whole self, acknowledging it, let's put it in front of you, and then let's determine what it's in service of, and what are your goals, and where do you want to be, is just so I'm really encouraged by having something like this in the city. It doesn't exist, in my opinion. Because when I moved back from Baltimore, I shared this, I looked for something like this and it didn't exist. And so Anchor Wellness is the first one that I've really seen that is coming in with this whole self approach, but in particular is been successful in allowing for you to take ownership and accountability over your own, not just keeping you coming back, but setting you free into the wild for check-ins, and getting to do the fun stuff, like I said, Pilates, and go to do classes and things. And it doesn't have to all be about like the therapy portion all the time. Yeah.
Right. Yeah. I think, there's lots of health coaches out there. I think what we are doing different is bringing them into a clinical environment.
Yeah.
And I think it's cool because, I think we're starting to see that trend change in the healthcare world. To air some dirty secrets, those of us who are licensed have always been intimidated by people who are unlicensed, or thought as though they didn't get to play on the same field as us. And I think what I recognized with the health coaches that I've gotten to know and worked with is they contribute something far better, far more superior than what I can do, what I can provide under my licensure. But the trend is changing, in terms of really fun happenings with Anchor. We've partnered with a local healthcare organization to provide health coaching to their members, and executive coaching. Health coach screens for executive health. And so we've got that on the horizon, which is really exciting, and especially given the practice that we've partnered with, because it's a traditionally very evidence-based practice, which is lovely. Evidence is super important. I will never advise against following an evidence-based practice, but evidence-informed is even better. That's where we're using evidence to guide us, but we're also using clinical experience and personal experience. Because why would I want to take me, Sarah Crawford's personal experience out of the equation? I've lived, I've experienced things. Why would I just, shove that in the corner and only use what the data tells me, which data, as we've all seen this year, can be quite flawed.
Yeah. Well, and love that. That's why I love you. Like, Sarah, this is the one thing that you'll learn about Dr. Crawford is she keeps it so real, and it makes for such lovely, fun conversation. And I appreciate it so much. Very much, for like the transparency and honesty that we are really trying to provide with Wise. Love the philosophy of data informed, because I do think that there's so much without really having the conversation, that's that transactional nature that we're really trying to get away from, and getting more into like the building of the relationships longer term to help support our long-term goals and needs. So tell us kind of what's going on throughout the month of December as we kind of close out the conversation with Anchor, and how can people find you?
Sure. Yeah, so we are, we had actually a webinar today on sort of surviving the holidays without sacrificing everything. And that was hosted by Krista Watkins. And then Morgan, I think you commented that you did a yoga therapy session. I'm not sure if you did it with Dr. Chavez Klein or Meredith, but Meredith is hosting a stress less holiday series that's virtual, just to give people an opportunity, like space, 45 minutes of just relaxing. And so we've got those two events going. We are frequently partnering with other like-minded businesses. So we've got a pop-up coming up and a mask sale with Bar 3 Montgomery. That'll be early next month. What else do we have? We've got a discount on our gift cards right now through the end of the year that can be used for any of our services. And and then the consults. We've got the free 10-minute phone consults for anybody. And that's a standard that's always present, that we're always ready to get on a phone and answer any questions we have.
I love that. I love the 10-minute consult. Just like hopping on the phone, asking a few questions, seeing where to go and navigate from there. That's awesome. I love that. And I know that we, in the coming year, we've been navigating this COVID situation as carefully as we can, but we definitely want to get in and test out more with what our group could do with Pilates, of course, in a small space. It's something that I really believe in terms of the whole body. I'm a runner, but I'm really trying to be smarter about the way that I get my body fit and how I can take care of that. So that is one area that in the new year, we will definitely be trying to provide some ongoing support through Wise with. So
yeah.
Well, I really appreciate the time today. Thank you so much. I really appreciate it. And we know you'll continue to see more from Anchor Wellness coming out through a lot of our communications and our newsletter, as well as partnering with Sarah on being able to reshare some really important content. If you're not signed up for their newsletter, I highly encourage you to do so. Wow, there's just some really powerful information in those that I just can't recommend them enough. They're from a really real tone of voice, which I appreciate. It's medical. It's not medical jargon. You can understand it. It's digestible. So from Wise perspective, so what do we have kind of coming up? We have a Skin Health Circle tomorrow night. If you are interested, please reach out to me or at hello@wisewellnessskill.com. We have a mixology class coming up with Homemakers Bar on Friday evening. Really excited about that. RSVPs for that are closed at this point, but if you are interested in following along and just watching, go ahead and reach out to me as well, and we'll see what we can do there. You just won't get the box. We've got a couple of really exciting things coming up over the holidays. As I mentioned, we're partnering with Crunchmaster and Curvy Cardio to be able to support virtual courses through Morgan Angelique Owens through the whole month of January, as well as launching our Healthy Bodies challenge with the Christ Hospital. That looks like a 6-month plan dedicated to helping you set better goals, but also allowing for you to really understand what your motivators are. So having that dialogue and conversation. Those conversations will be happening on a monthly basis, hosted on Facebook, and we will make sure that you get all of your information. There are engagement prizes that you will have access to from local wellness businesses throughout the course of that 6 months. So highly encourage you. We've got a lot just going on. Don't forget to recommend to a friend that Wise Wellness Guild is free, completely free membership at this point. It's our gift back to you to be able to invest back into yourself. So thank you so much again for everybody for joining today. This will be available for replay that we will host on Instagram as well as YouTube and our Facebook. Dr. Sarah, as always, it's a pleasure. You're incredible. If we don't, do we have any other questions from anybody before we sign off?
Thank you for having me, Stevie. We have to talk about how we're both 3s. I just learned that I'm a 3.
I know. we have a lot. My team will laugh so hard because in true 3 form, and I warned Morgan that this would happen in true 3 form. I had a little bit of a moment this week where like high stress, high anxiety, and it was like, all right. And I got into like my like conductor mode. I was like, this is supposed to be blah, blah, blah. And like just the steam rolling. And I'm like, oh, like got to learn about again, that self-awareness to know like those triggers, how you can better manage them. And we don't stop, we're like crazy. Our expectations of ourselves are much higher than we would ever have of anybody that we love. So definitely learning a lot about that in the new year for sure.
This is an interesting path to try and figure this out. So I'd love to pick your brain on it more.
Yeah, well, no, and your fearlessness of diving into this space, I think that that's the last piece I would say from entrepreneur to entrepreneur is that owning your own business in a pandemic is no joke, but you know what? We're doing it, and it's all in the service of really trying to help advance people in their wellness and trying to just create a better world. And there's no place that I would rather be than this. I pinch myself every day, and it might be hard, but it's better than, going and building somebody else's dream. So we'll definitely, I can't wait to get back together. And especially when we can all get back together as a group to be able to do some really cool stuff together. So.
Right. Yeah. Well, everyone, thank you so much for interacting and sharing and asking questions. It was lovely to be with you all.
All right. Thanks so much. Have a good one. Everybody have a good. See ya. Bye.